Hi, welcome to another episode of Sports and Sports Related Injuries. I am grateful for your appreciation and support that encourage me to bring up new health topics for discussion. Today, let us start with heat injuries in sports. Heat injury is a common illness in young athletes, especially children with higher secondary grades. As temperatures around the globe continue to rise, heat injuries become more common. By the way, are you doing your bit to decrease climate change? Like going for electric vehicles, using solar panels, and not burning coal and wood? I hope you are. Heat illness can be mild with just muscle cramps or severe like a heat stroke. The probability of a heat injury can be predicted with the help of a heat stroke index chart. Heat stroke index recommendations vary with temperature and relative humidity of the place. But in general, playing between 32 degrees Celsius and to 41 degrees Celsius requires caution. And in temperatures above 41 degrees Celsius is dangerous with high risk of heat stroke. As a child, my grandmother used to tell me to put a small onion in my pocket when I went to play in the summer sun. I don't know how it can help, but it reminds me to be cautious while going out in hot weather. And yes, children are more vulnerable than adults to heat injury. The reason is that one, they have a lower sweat rate, they sweat less, and second, they have a blunted thirst response. They feel less thirsty. This all makes them more at risk for injuries. Heat illness can be grouped into three main categories. One, heat cramps. Heat cramps are muscular cramps that usually involve the hamstring and the calf muscles. They can cause tetany or syncope, but usually respond to avoiding further exposure to heat and oral dehydration. Second, heat exhaustion. Heat exhaustion is a mild illness where body temperatures rise between 100 to 103 Fahrenheit and a person may have headache, nausea, vomiting, and feel weak. Such athletes should be placed before a fan and given ice application. Oral and IV fluids are indicated as needed. Heat stroke. The most severe heat injury is heat stroke. An athlete may sweat profusely or have hot, dry skin. Body temperature reaches about 104 Fahrenheit and patient may have CNS symptoms like irritability, hallucinations, or seizures. This is an emergency and the patient should be rushed to the hospital as soon as possible. Heat illness can be prevented by keeping yourself well hydrated and taking break from sports every 30-20 minutes. For athletes who practice for less than 1 hour, plain water may suffice. But for those who play for more than 1 hour, need fluids with carbohydrates and electrolytes. So remember, do not burn in the sun if you have to shine like the sun.